Everyone deserves to have access to quality health care, whether it's for routine checkups or personalized services. Dr. Eric Stanek from DoctorsNow is here to share more about the importance of direct primary care. But first, even just finding a primary care physician, why is that so important?
Well, it's important because there's a lot of things that go into health, nutrition, exercise, what you do for work. Health is multifaceted. And so it's important for pretty much everybody to have a primary care doctor that they know and trust. They can come in and establish, and we can learn your medical history, your surgical history, allergies, all of that standard stuff. But we like to know more as well. We like to know what your family situation looks like. We like to know what you do for work, what you've done for work in the past, and all of that information helps us to make informed decisions in regards to your health.
Because it all plays a role, I would imagine.
Yeah, everything plays a role. It's more than just treating numbers on blood work or treating a number on your blood pressure. Different people have, there's different ways to go about treating people's health. We like to meet our patients where they're at and try to work with them from there.
You have something called direct primary care that you launched earlier this year. Tell us what that is.
Yeah, so we're very passionate about direct primary care, and the name is, gives you a lot of information on what that means. It's primary care, like we just discussed, but it's direct. Direct meaning direct between the patient and the practice. There's no middlemen, there's no insurance, there's no requirement to have insurance to have direct primary care. If you think about what the word insurance means, it's usually something that consumers can opt into in the event of infrequent, unpredictable, and often catastrophic events. If you apply that framework to home insurance or car insurance or life insurance, then that's what insurance is for. But in health insurance, it works differently. There's often a requirement to have health insurance in order to have your annual physical or other predictable scheduled events. And so through direct primary care, there's no requirement to have insurance. We're happy to meet you where you're at, and it gives good accessibility to patients and affordable, transparent pricing as well.
Now, is this a replacement for health insurance? Can you have both health insurance and direct primary care?
Yeah, so direct primary care is not health insurance by name. DoctorsNow is attached to the walk-in clinic too, so when people do get sick, have a laceration, something like that, direct primary care patients can come in and be seen for that as well. But technically speaking, it's not a replacement for health insurance. What we encourage people to do is to couple direct primary care with a high deductible plan with lower premiums. That way, if you combine that with direct primary care, you can save a lot on your monthly premiums rather than going through a traditional marketplace plan.
And how can this help maybe employers and employees?
So employers are spending over $1 trillion in total healthcare spending right now. A lot of times they're just going through their annual renewal, and they don't really have a good idea of what their costs look like. Now, through the Affordable Care Act, all employees that have 50 or more full-time, or all employers that have 50 or more full-time employees are required to offer health insurance to their employers. A lot of times the employers are covering the cost of that, but the costs are still too high for employees, so they're just opting out of health insurance entirely. And of course, from the business perspective, they want their employees to be healthy. They want them to have good access to care. Employees like to have those benefits through their employers. And so direct primary care is a great option for employers. They can structure that with a wraparound high deductible plan like we talked about before, or even just using direct primary care as a bolt-on so that their employees can have good access and it's good price transparency for the employers as well.
What results have you seen so far since you launched this?
We've had a good amount of patients established with us for direct primary care. And a lot of times when people come in, they haven't seen a doctor for years or even decades. Sometimes people don't even know what's going on with them. Life is really busy. They haven't been able to see a doctor. We've had multiple cases of patients coming in, and they didn't even know that their blood pressure was in the 180s over the 120s. They didn't know that their blood sugars are running in the 200s or 300s. They didn't know that their LDL cholesterol was in the 200s, triglycerides in the 800s. These are all markers for chronic disease that don't necessarily present themselves unless you're able to get in and see a doctor. And so when people come in with these abnormalities, we see it all the time, we can do all the treatment for them in-house. We carry medications in-house that are covered under direct primary care. Patients don't have to pay a dime for them. We can do all of your blood work, we can do your x-rays, you don't pay anything for that either. It's all included under the subscription. And we're able to get people well within a few weeks or a few months, and we think that there's a lot of value that we can provide for patients with direct primary care.
Well, Dr. Stanek, thanks so much for being here to share this. And people can learn more. Just go to DoctorsNow.com or call 515-471-1860. There are locations in Altoona and West Des Moines. And you can see more on social media.